Hi, my name is Kate Charlesworth. I'm the Environmental Sustainability Lead at South Eastern Sydney LHD. I'm a public health physician and I also have a PhD in low carbon healthcare. So many of our staff are really interested in sustainability and I get a lot of requests to speak or to run workshops. But obviously that's not possible in the current climate, and so I've recorded this presentation. Now, my face-to-face sessions are usually very interactive with Q&A and discussion. Again, that's not possible in this format, so my email address is on the bottom of that slide. Please do feel free to get in contact if you have any queries or if there's anything that I can do to support you or your team. This is what I'll be covering today, and there are three key messages. One, climate change is a health issue. And as a district, and indeed as a health sector in this country, we're at significant climate risk. Secondly, health professionals have a particular responsibility and opportunity to act. And then in the last section, we'll be looking at what you can do based on our top 10 actions for 2020. To start, I just have 3 slides about climate science and common myths. Okay? So this is climate science, quick overview in 1 slide. So the Earth has around it a layer of greenhouse gases. And common greenhouse gases are CO2, carbon dioxide, water vapour, nitrous oxide, methane, a bunch of others. Okay? And they are greenhouse gases because they're good at trapping heat, okay? Just like the greenhouse in a garden. So the Earth has around it this thin, like a thin blanket of these greenhouse gases. And they have kept, and we need it, without it the Earth would be way too cold for us to live in. Okay? And for thousands of years, that layer has kept the Earth at like the Goldilocks temperature, okay? Exactly the right temperature in which human civilization has thrived. But then about 250 years ago, something happened, and that was the Industrial Revolution. And at that point, we started digging up fossil fuels, so coal and oil and gas, and burning it, which produces CO2 and a bunch of other things. So for a long period of time, thousands of years, we've had this delicate balance. And in the last 250 years, quite a short period of time relatively, we've been burning fossil fuels and adding more and more and more and more CO2 to this thin blanket, okay? So it's now become like a couple of thick quilts and we've got global heating. There's a number of myths around climate science. Myth number 1 is that, scientists can't agree about global heating. This slide is from NASA, so a very reputable scientific source, and it's to dispel that myth, okay? And I'll talk you through it. So on the x-axis, you've got time, so from 1880 right up to about 2012. And then above it, on the y-axis, you've got temperature, basically temperature above and below average. And there are 4 different coloured lines on that slide, and they represent 4 different leading scientific organisations. Now, every year, those 4 different organisations compile their temperature data. They have thousands of different temperature stations around the world. They compile that data, and then they make an independent judgment about whether that year was warmer or cooler than on average. Okay? So those are those 4 different coloured lines on the graph. So you can see that there's a bit of variation, but overall, those 4 lines agree extraordinarily well. All show these peaks and troughs in sync with each other, all show rapid warming over the past few decades, and all show that last decade was the warmest on record. That's why they say now 97% of scientists are walking around in a state of suppressed panic. Myth number 2 is that, the CO2 rise that we're seeing, that's just part of the natural variation in the Earth's climate. Okay? So this is to dispel that myth. Again, it's from NASA, and I'll talk you through it. So we're at time 0, sort of on the right-hand side, and then this goes back more than 400,000 years. And then on the y-axis, you've got CO2, carbon dioxide in parts per million. That's the CO2 concentration. Okay? So you can see that indeed the CO2 concentration has varied quite significantly in the Earth's history between the warmer interglacial periods and then the colder ice ages. But I often say, well, where are we now? Okay? We're completely off the scale. We're beyond the realms of that natural variation. The actual gradient of that is almost horizontal, of this last rise is almost horizontal. This is an unprecedented rate of change. And of course, it's entirely consistent with what we've been doing for the past 250 years, which is burning fossil fuels, using CO2. Okay? So that's why scientists now say we're actually entering a new geological age, the Anthropocene, anthropo, caused or induced by humans, in which humans are actually dictating, in a really dangerous way, the Earth's climate. And so this is how we're perceived overseas. This is from the New York Times. The point here is that what we're seeing is not normal. Half of the Great Barrier Reef has been killed by underwater heat waves. Okay? We had prolonged drought for several years. Then we had unprecedented bushfires, with rainforest burning. And then the smoke haze, which affected millions of Australians, and then storms and floods. This is not normal. Okay? And Professor Will Steffen, who's an Earth Systems scientist at ANU, who's one of our leading scientists, he wrote this article recently, and he makes two really important points. The first one is that scientists have actually underestimated the immediacy and the seriousness of the impact. And in Australia, for what we're on track for, Australia is going to be a pretty difficult continent to survive on. And the second point that he makes is the urgency. It's really important to understand that climate crisis is not going to be a linear process. Okay? There are tipping points and feedback loops inherent in the Earth systems. So once we hit a few tipping points, things will very quickly spiral out of control and we won't be able to claw our way back. Okay? And there are now some serious scientists contemplating the prospect of a hothouse Earth in which temperatures rise to 5 or 6 degrees above pre-industrial temperatures. And in that situation, of course, a lot of the world would not be habitable. So if you think we've had disruption over the past few months, it's really just a warm-up for what's to come. And why is it a health issue? So when most people, including most health professionals, are asked what the health impacts of climate change are, these are the sorts of things that they say. First one is cataracts and eye disease, malaria, sunburn, floods, heat waves, bushfires. And these are all true. But these aren't the big issues. The big issues, that's food and water insecurity, economic disruption, mass migration, civil unrest, and Easter Island. And Easter Island, of course, the story of civilizational collapse. Such a remote island out, Polynesian island out in the Pacific, basically cut down all their trees, used up all their resources, and effectively wiped themselves out. Civilizational collapse. And the analogy, of course, is this is what we're doing, but on a planetary scale. There's no planet B. And these things are not an exaggeration. This is from the British Medical Journal, one of the leading medical journals, talking about the IPCC findings. Future threats of further global warming, increased scarcity of food and fresh water, extreme weather events, areas becoming uninhabitable, mass human migration, conflict and violence. This is why we're worried. And this is why increasingly we're seeing headlines like this and like this. And then this graphic really just reflective of the title of today's presentation, Flattening the Climate Change Curve. And now just a little story. This is Eric Chivian. He's a Harvard physician and a Nobel Prize winner. And he tells a story about this creature. This is a cone snail. Now, cone snails are a group of predatory snails that live on tropical coral reefs. And cone snails paralyze their prey for food, so small fish and mollusks and other things, by firing a poison-coated harpoon at them. And there's about 700 different species of cone snails, and each of those species has several different hundred peptide poisons they put on their little harpoons. Now, so far, medical scientists have only investigated about 0.1% of all those different peptide poisons. And already they're making some remarkable discoveries. So ziconotide is a new drug used to treat severe chronic pain, unresponsive to opiates. And what's remarkable about ziconotide is not only that it's 1,000 times more potent than morphine, but also that it doesn't cause tolerance. So this is like a holy grail in pain medicine. This is what pharma companies have been looking for decades, and they found it in a cone snail. And there's a bunch of other cone snail products at various stages of clinical trials. There's some for protecting nerve cells after head injuries, some for protecting cardiac cells after heart attacks, some for treating severe chronic epilepsy. Medical scientists think that cone snails could lead to more important human medicine discoveries than any other group of organisms. There's one problem. They live on tropical coral reefs and they could all be gone with the reefs. So this is just one example, one little story of what loss of biodiversity and global heating actually means for health and for medicine and for humanity. And climate change is an issue of social justice. This is a cartogram. It was published in The Lancet about 10 years ago. And it shows, for the period 1950 to 2000, the production of greenhouse gases by region. Okay? So which region's the biggest polluters? It was North America and Europe. The second part of the cartogram shows, for the same period of time, the distribution of 4 climate-sensitive health impacts. They looked at malaria, malnutrition, diarrhea, and inland flood-related fatalities. So which regions suffered the most from climate change? Africa, South Asia. And this is on a global scale, but we see the same thing at a national, regional, and local level. Those people who have contributed the least to the problem are being hit the first and the hardest. We'll get all of us in the end, but at the moment, it's children, the elderly, babies, rural and remote populations, low socioeconomic groups, these people who are being hit the most. And of course, they're the people who are, in most cases, have the least capacity to adapt. So climate change is an issue of social justice and health equity. And I just put up this slide to remind me, we talk a lot about climate change, but of course these other environmental issues, plastic pollution, soil and water contamination, deforestation, these are all equally important. Okay? This is the Great Pacific Garbage Patch. It's a mind-boggling amount of rubbish out of the Pacific Ocean that is 3 times the size of France. So you would think that given the urgency and the seriousness of the situation, okay, that governments around the world would be acting and we'd all be in like an emergency mode. We're not. There's probably a whole bunch of reasons for that. But for a health audience, I always like to make this point. Who do you think said this? This is Naomi Oreskes, and she, together with Eric Conway, wrote this book, Merchants of Doubt. Basically, it is well documented in this book and elsewhere that the tactics used by the fossil fuel industry, okay, creating doubt, obfuscation, discrediting scientists, intense political lobbying, setting up front organisations, these tactics are precisely the same tactics and in many cases the same PR organisations and the same people who are involved for so long with the tobacco industry. And they've been remarkably successful. They are powerful, they are well funded and well organised, and they have been very successful in delaying an appropriate response to the climate crisis. So just as in so many other areas of health, you absolutely have to be aware of the wider context. Okay, health professionals and our responsibility and opportunity. So I'll come on to the research, but just to start with a little story. So in the 1990s, a group of clinicians at a paediatric unit in California began to recognise, this is based on some new EPA data that was coming out, that dioxins, of course a potent carcinogen, dioxins from medical waste incineration was making a lot of children sick. And a number of those children were then presenting to their hospital. So there was this awful irony in that system that was supposed to be looking after children was actually a major cause of paediatric disease. They were in fact producing their own patients. And this was the beginning of Healthcare Without Harm, which has subsequently grown into a global organisation. In Australia, we're now starting to quantify these sorts of problems. This is a seminal paper published about 2 years ago, which measured for the first time the carbon footprint of the Australian health system. And the headline finding is that it's 7% of our national emissions. That is the same as the total emissions of the state of South Australia. And this pie graph shows the breakdown of that footprint. And there's a number of notable findings here, but in particular, hospitals, if you add together public hospitals and private hospitals, and then a lot of capital expenditure as hospitals as well. So if you add those together, hospitals are about half of the footprint. And also interesting is that pharmaceuticals, that dark green section, is nearly 20% of the entire footprint. This is our carbon footprint at southeastern Sydney. You can see in the purple section that electricity is a big contributor. But all that other stuff, scope 3 is a lot of the stuff we buy and use, and a lot of those other small areas. This is all the stuff we buy and use every day, from food, furniture, equipment, pharmaceuticals, medical devices. All of that stuff really adds up. Okay? So which indicates that we have a really carbon-intensive healthcare system. And having a big carbon footprint is not only a problem because we are then big contributors to the climate crisis, which is harming human health, but it's also a problem when the world is shifting towards net zero carbon economies. The New South Wales government has set a target of net zero by 2050. Under this recently released plan, this sets out how they're going to reduce that by 35% in the next 10 years. In other states, of course, for instance, in Victoria, that net zero by 2050 is actually the law under their Climate Change Act. And a lot of people say, oh, well, 2050 is a long time away, and that's true. But crucially, under this legislation, they have interim targets. So we have colleagues in Vic Health who are now scrambling to think how they're going to meet their first target, which is in 2022. So I think the point here is that clearly this is a pretty rapidly shifting legal and political and regulatory space. But given the science and given all the science, it would be prudent to start paying attention. And opportunity, okay? We actually have a tremendous opportunity, and that is because so many things that we need to do, the environment, will actually have tremendous health benefits. Okay? So for example, walking and cycling rather than driving cars, good for health, good for the environment. Eating more plant-based foods, good for health, good for the environment. Renewable energy, good for health, good for the environment. There are lots of these win-win situations or these co-benefits. And actually in the health system, there's very good evidence now that it's not just a win-win, but actually a win-win-win situation for health, for the environment, and for the financial bottom line. Okay? In the NHS, they have reduced their carbon footprint in the last decade by nearly 20%, and they have saved about £1 billion. So we have a good story to tell. Okay? And who is best placed to tell that story? This is Ipsos Mori, a social research institute in the UK, and they've ranked last year the most trusted professional groups in society. So you can see there that nurses are the winners, 95%, but doctors aren't far behind on 93%. The key point here is that health professionals are the most trusted and respected professional group in society. We have enormous influence, not just in our personal connections, but in our communities, in our professional organisations, and in the media. The climate crisis threatens the health and indeed the safety of our families, of our patients, and of our communities. And so just as we spoke up on asbestos and on tobacco, so we have a responsibility to step up on climate action. So what can we do? There's a huge amount that you can do personally and professionally, but these really is a focus here on workplace action. So based on our SESLHD sustainability plan, we've developed a top 10 actions for 2020. And these actions are very well aligned with the SDGs. The United Nations, UN, Sustainable Development Goals, or SDGs, are a set of 17 goals, which are really like a universal ambition to protect the planet, end poverty, and to improve the lives and the prospects of people everywhere. And the 17 SDGs have all been adopted by all UN member states. Okay? Now, because human health and planetary health are, of course, inextricably interlinked, all of these goals are relevant to us, but we're going to be focusing on, in the first instance, on 3 goals, which is number 3, you can see there in the middle, good health and well-being. Number 12, responsible consumption and production. And number 9, industry, innovation and infrastructure. And so as I'm going through our top 10 actions with just some stories and examples for each, you'll see in the top right-hand corner the relevant SDG. Okay, so action number 1, perhaps not surprising from a public health doctor, to focus on prevention. Okay, and that's because, of course, the greenest health system is a system in which people didn't get sick in the first place. So this is just in recognition that things that so many of you do every day to keep our patients and people well and healthy and independent in their homes or in their communities, and to prevent hospitalisations and to prevent readmissions, these are all sustainability actions. And there is now growing evidence, for instance, around the importance of social capital and social networks as an independent determinant of health. Okay? In this example, this is just one intervention initiated by a group of GPs in Somerset in England. And this was a community intervention that really consisted of care planning, community coordinators, social prescribing, and this idea of structure of compassionate communities. And as a result of this intervention, they have reduced their unplanned hospital admissions by 14% and saved 20% of their costs. And that is in comparison to elsewhere in the county, in which there was a 28% increase in unplanned hospital admissions. So now there's starting to be sort of concrete evidence of the importance of these sorts of interventions. Exercise, of course, in keeping with this theme of keeping well, is, as this author points out, if it were a drug, it would be like a miracle cure. Substantially reduces individuals' risk of everything from heart disease and diabetes to dementia and depression. Okay? And this, and the author here, who is an orthopaedic surgeon, makes a really important point that a lot of people with medical conditions don't think that exercise is relevant to them, and that health professionals have a really important role in challenging that myth. Okay. This is an excellent resource from some of our health, sports and exercise doctors, moving medicine. It sets out for a whole range of different conditions. If you've got a 1-minute consultation, if you've got a 5-minute consultation, the appropriate advice that you can give your patient. Okay. Action number 2, move towards zero waste. Now, the important thing about waste is that waste hierarchy. So you can see the upside down triangle there. And the important thing is that prevention or avoidance is at the top of that triangle, and then reduce, reuse, and recycle. Okay? So reusing and recycling are important, and in some cases that's all that we can do. But if we really want to cut to the chase, we should be trying to prevent or avoid wherever possible. And certainly in our offices and in our tea rooms, we should be shifting towards zero waste. In particular, food waste is really important. If food waste were a country, it would be the 3rd largest emitter on the planet. Okay? So really important to reduce food waste. Clinically, it's important to understand that waste is really expensive, both financially and also environmentally. A recent study at the Royal Melbourne Hospital found that the disposal of surgical waste cost 5 times as much as the actual equipment itself. Okay? Now, in our clinical areas, the key most important action that we can do is appropriate segregation. So, for instance, only putting in clinical waste what absolutely needs to go in clinical waste. Okay? It's much more expensive, both environmentally and financially, than the general waste stream. And this is just an important graphic to show the difference between biodegradable and compostable, and then also the importance of reusable items. This is an example from Great Ormond Street Hospital in London. Staff there were really concerned about the use, or they perceived overuse, of non-sterile gloves. There are examples of staff using gloves just to bath a baby or to push trolleys around. And so they ran a concerted staff engagement campaign about the use of non-sterile gloves. And as a result of that, they saved about 20 tonnes of plastic and about 90,000 pounds. Action number 3, eat more plant-based foods, good for health, good for the environment. And this is Boston Medical Centre, in which they grow organic fruit and veg on the hospital roof. And they use that in their patient meals and in their cafeteria. And they have around this garden a whole bunch of community and staff engagement campaigns about healthy eating and cooking and so on. Action number 4, reduce unnecessary tests and procedures. There is growing evidence, as many of you would be aware in medicine, about the harms and risks and the costs of overdiagnosis and overtreatment. Okay? And the costs are not just financial costs, of course, but also environmental costs. And so these sorts of papers now being published. Is the recent one published in MJA with a spotlight on cancer, focusing on thyroid and prostate cancer, but this is equally important to a number of other specialties. This is a paper published in the Medical Journal of Australia just last month, in which the authors have actually measured the carbon footprint of the 5 most common pathology tests. They looked at full blood counts, Usenease, coags, CRP, and ABGs. And these are some of the findings there. Of note, a full blood count is equivalent to driving a standard car nearly 800 metres. Prescribing, action number 5. So if you recall, pharmaceuticals are nearly 20% of the carbon footprint of our whole health system. Okay? It's probably because pharmaceuticals have a very long supply chain. Think about it, this research and development phase, and manufacture, distribution, transport, packaging, wastage, and so on. Also, the actual manufacture process is very chemical intensive and very carbon intensive. So pharmaceuticals are a key carbon hotspot, I would say. And of course, they have significant harms and risks to patients. We look at the impacts of side effects, of drug interactions, of polypharmacy, and so on. So as a clinician, one of the most important things that you can do is to optimise your patient's medication use, reviewing medication charts and deprescribing wherever possible. This article recently noting that nearly 1 million Australians take 5 or more medicines a day. As the authors note, in many cases that's entirely appropriate, but they were concerned about evidence of harms, particularly of older people, from polypharmacy. Action number 6, consider sustainability in your clinical decisions. Okay. So this is the key point here on the title there. Carbon will be as important as money. Okay. It will be like a new currency. And so as health professionals, we need to start thinking not just about health outcomes, which of course is always our first priority, and not just about financial costs, but also about carbon costs. So we'll need to become carbon literate. And just as an example there, the Centre for Sustainable Healthcare in Oxford in the UK is now offering training to health professionals about carbon footprinting. And just a couple of examples from different specialties from about inhalers. Okay? So hydrofluorocarbons, which are used as the propellants in meter dose inhalers, are potent greenhouse gases. And the NHS have actually found that inhalers are 8%, contribute 8% to the whole of the NHS's carbon footprint. We don't know the numbers in Australia, but of course we have 2.7 million people in Australia who have asthma, for instance. A number of those would use inhalers. So there are, as you can see in this slide, some lower carbon alternatives. Obviously dry powder inhalers aren't suitable for everyone, but there is now some research underway in this area. Just in this example, researchers from Monash University in Melbourne are looking at reducing the carbon footprint of inhalers. In anaesthetics, desflurane is a commonly used anaesthetic gas, but has a global warming potential 60 times greater than other gases. And so this is, in this example, a group of anaesthetists in Bristol are looking at engaging with their colleagues to shift from desflurane to sevoflurane and other alternatives where appropriate. Ophthalmology, cataract surgery is the most commonly performed procedure in the world. And so just by virtue of volume alone has a significant environmental impact. There's growing research now around the carbon footprint and the waste from different types of cataract surgery and different models in different countries. Plant a tree, action number 7. Trees have a whole range of health benefits, from hastening patients' recovery times to improving staff well-being and retention, to having a cooling impact, providing shade. Actually, trees can reduce ambient temperatures by up to 8 degrees. They also reduce air pollution, provide space for physical activity and social interaction. There's a whole range of health benefits from trees. And they're also really important climate mitigation and adaptation tools. So this is actually a really important action. In the NHS, they have a program called NHS Forest, in which they have planted now 65,000 trees and developed green spaces and gardens and things on NHS facilities and grounds. And just this is an example. This is Alder Hey Children's Hospital in Liverpool. You can see the park there, and then to the left of the park, the top is the hospital, and then the car park below it. So that's the old hospital. This is the new hospital, and then look what they did. Action number 8, active transport, a very good example of the co-benefits. Okay, good for health, good for the environment. There's a whole bunch of case studies that I could have put in this section. Just to choose one, this is in Newcastle in the UK. The Newcastle City Council declared a clean air zone. And that's put in place, triggered a number of changes all around the city. In their hospitals, in one of the hospitals, they used to use diesel vans as a courier service. They've now shifted to electric cargo bikes and have had significant benefits from these bikes, not only reducing obviously the carbon pollution, but also they're just as quick, they're able to manage the loads really well, and they've reduced congestion, reduced the use of delivery van bays and so on. So that there've been unexpected benefits from that project as well. Action number 9 is switch off. Clearly we need solar panels on the roof, we need LED lights, but research has shown that 5 to 10% of our energy usage could be reduced just through staff behaviour. That's an important action. And then finally, using your personal influence, as mentioned. So 3 actions to get started. The first one is that you can sign up to our SESLHD Sustainability Network. Just email me and ask to join, and I'll connect you with that. That means you'll get occasional emails and updates from me. And of course, you can work towards our top 10 actions. The second one is to join a climate and health group, and I'll run through some of those now. And the third one, to get informed and get active in your community. Or if you want to play more of an important role as a health professional, please get in contact with me and I can connect you with the right people or support you. For doctors, this is Doctors for the Environment Australia, a terrific organisation and rapidly growing across Australia of doctors and of medical students. Their website there. Climate Medicine, terrific resource set up by a colleague in Adelaide. For nurses and midwives, the Australian College of Nursing has a policy chapter on climate and health, and also a new community of interest. New South Wales Nurses and Midwives Association. This is them at the climate strike last year, and that's how you can get involved there. Just before I finish, I'd like to alert you to a number of resources and organisations. They're listed there. And the last one, the Natural Climate Solutions video, 3-minute video about climate solutions, about what needs to be done. Just a favourite quote from Margaret Mead. And then this is my final slide with my email address. Again, please do feel free to get in contact if there's anything that I can assist you with. Thank you.